Hi everyone, my greetings to you. Today I am going to present a brief synopsis on muscle cramps. Stiffness or muscle cramps is quite common. It is uncommon in children below 8 years of age, but it rises exponentially beyond 8 years to 7.3% in children and more than 30% in people above the age of 60 years. It's especially common in people who exercise without any prior warm up, without stretching. And they tend to affect muscle like hamstring, the calf muscle, as well as the feet muscles. It can also involve any part, maybe in the trunk, it may be in the neck, as well as in the hands or the arm, or anywhere can be affected. It's also common in people with pregnancy, in the last trimester of pregnancy, where they would present with a nocturnal painful muscle cramps, and so it's difficult to treat unless you know what all the pathophysiology, what are the precipitating factors. The most important precipitating factor is dehydration. Take more water and do exercise with good prior warm up. Okay, fine. So you know that the cramps or the stiffness can be due to varied causes. It's a protein causes. It can start from the brain to the muscle. If you take the muscle, they may be due to various muscle disorders like myotonic dystrophy, various myopathies, or other dystrophinopathies, many muscle disease, or various enzyme related muscle disease like carbohydrate storage disease, lipid storage disease, comital CPT deficiency, myophospholate deficiency, myocardial syndrome, lipid storage disease. Many metabolic myopathies can present with a painful contracture or spasm of muscle, especially while prolonged walking, or if you do a intense activity, depending on which part is, whether it's a lipid storage disease or whether it's a carbohydrate metabolism is affected, or there's a mitochondria. Similarly, there are the deficiencies of various minerals like calcium, magnesium, sodium, potassium. This can also result in muscle pain, spasm, cramps, weakness, or stiffness. So should always careful of these mineral abnormalities or imbalance. Similarly, there are problems with the various nerves like peripheral neuropathy, restless leg syndrome, or problem with the nerve roots called a radiculopathy. Or there are certain conditions called motor neuron disorders like amyotrophic lateral sclerosis or MND. I'm actually I'm bringing one video on this motor neuron disease soon, maybe in a couple of weeks' time. So motor neuron disease is also present with something called fasciculation, cramps, and stiffness of limbs, painful stiffness. I've seen a couple of cases. I mean, not couple, many cases. Ultimately, maybe 1 or 2 cases every month. So I don't know why the motor neuron disease is on the rise now. Similarly, there are problems in the anterior horn cells due to some other cause, like a stiff person syndrome, or due to some malignancy like breast malignancy or lung malignancy, which is causing stiffness of limbs, stiffness of the limbs and body, difficulty in walking, spasm involved from the neck, shoulder, arms, trunk, and limbs. Something called a stiff person syndrome, or a neuromyotonia, Isaac syndrome, Morvan syndrome. Many types are there. Then there are problems with the spinal cord. Spinal cord is like a spinal neuronitis, which can also present with the stiffness and cramps. Then there are problems in the brainstem as well as in the cortex, because you know that there are some patients with epilepsy. They can also come with stiffness or hypercontracture or contraction, or something like a tonic fits. So what I meant is any problem starting from the brain to the muscle can invoke the stiffness, cramps, or spasm. But there are some families with benign fasciculation cramp syndrome. There is just some fasciculation of the muscles without any danger. It's normal in some families. So don't worry. All the people who get some sort of fasciculation or cramps are pathogenic. There are many people with a normal cramps, normal fasciculation. So I can assure that 99.9% of the cramps are of no sinister significance. They are benign. They are harmless. But maybe there are 0.1 to 1% you have to evaluate. This may be due to certain muscle disorder or any of the neuroaxis from the starting from the brain to the muscle, or it may be due to various drugs like statins, cholesterol lowering agents. But don't don't be under the impression that this only. It is reported, that's all. Okay, then there are taking medication for the asthma, beta stimulants and amitriptyline. Some other medication can also give rise to spasm. And there are various causes like endocrinopathies, like hyperinsulinemia, hyperthyroidism, then the problem with the thyroid, low thyroid or high thyroid, or problem with the adrenals, or problem with the pituitary. So all these problems can also lead to muscle cramps. Yeah, okay. So as I mentioned, the cause can be many. Similarly, there are people with Parkinson's plus syndrome, Parkinsonism, dystonias, and I have seen a patient with a painful one-sided cramps in a patient with insular stroke, acute infarction. So I thought that this is not related to metabolic something like that, and I found that has an infarct in the brain. So very rarely, infarct can also give rise to unilateral painful tonic contraction. So that this is in just regarding the spasm, the various causes of muscle spasm or cramps. So you have to evaluate this patient by doing the blood tests like CBCS or blood sugar, renal function, liver function, cardiac function, thyroid function, CPK, LDH, ANA, depending on the level of involvement, whether it's a rheumatologic problem, it's an endocrine problem, whether it's electrolyte disturbances, whether it's a problem in the nerve, EMG, nerve condition study, maybe paraneoplastic workup, maybe EEG. So the list may be depending on the history, you have to tailor accordingly. Then of course you can do a EMG study too for whether it's a muscle is going to silent contracture, whether it's active trifascicular rhythmic discharges, whether it's a myotonia, where you get a dive bomber pattern. So you have to find out what is the nature of the EMG in these conditions. And once you know that this is muscle cramps and the various causes pertain to that, then you have to treat. Basically treat, which are all condition which cause these cramps, you have to treat. You have to address those pathology. If the patient is getting cramps frequently while doing exercise, ask him to take hydration, take more water, and avoid the soft drinks and cola, something like that, and avoid smoking. So do the stretching and warm up. Then of course you have to if in pregnancy you can start with all this the stretching, massaging, applying warm bath, or putting ice, or you can start straight with magnesium, calcium supplementation, vitamin D supplementation, B12 supplementation, and treating any endocrine disturbance like diabetes or thyroid disorders, adrenal disorders. If there are any drugs which would invoke the spasms, you remove those drugs like statins or beta stimulants or some other medications. So you have to find out what are the precipitating factors or which would augment the spasm or cramps. You have to remove those the precipitants. So okay, so probably I'm planning to bring a talk on motor neuron disease, on epilepsy soon, or maybe within a matter of weeks. So with these few words, let me conclude here by telling you that muscle cramps and spasms is quite common, and most are benign or harmless. But of course, there are a few conditions where you may have to investigate, you have to see the doctor, consult the doctor, and may need further investigation and evaluation. So thank you very much. Have a good day. Bye.